Living with psoriasis can be such a challenge, and although it's a chronic autoimmune disease that starts inside the body, it eventually manifests itself outside. Ask anyone who has suffered with psoriasis, and they'll share stories of covering up when their skin is red, growing up, and people staring at them. Today, we're joined by Sarah Del Ricci, who's been living with moderate to severe plaque psoriasis most of her life, and Dr. Jennifer Song, a board-certified dermatologist, who's here to talk about a medication to treat this condition. Welcome to both of you.
Thank you so much for having us.
Doctor, I want to start with you. I was reading here that psoriasis affects more than 8 million people in the United States. So let's discuss first what it is and what causes it.
Psoriasis is an autoimmune condition of the skin where inflammation starts inside the body, and the immune system overproduces inflammatory proteins that then attack the skin and produce these raised red flaky patches. The actual cause of psoriasis is not known.
We have some pictures I'd like to share with our viewers, and while we look at them, can you talk about where in the body people usually get psoriasis?
Psoriasis can actually affect anywhere in your body, but the most common areas are your scalp, elbows, and knees. And some patients can have very itchy plaques, others can have painful plaques.
Sarah, let me bring you in. I was reading here that your symptoms started at the age of 6. And your parents got concerned because you were scratching your skin a lot. Pick up the story from here.
Yeah, I noticed it on my elbows mostly, and my parents actually thought that it was ringworm or something. They weren't even considering that it could be something like psoriasis. So when I was taken to the dermatologist, I was giving topical steroids to help treat it, but it really was not, it wasn't something that a 6-year-old was really good at doing. So it was a treatment, and that's what I had at that time. So I did try to maintain coverage and went to like softer fabrics and different things to try and help, but it was always a struggle.
How hard was that for you as a teenager? Because, you know, as teens, we go to the pool, we go to the beach, and I know you would cover up, and it would be pretty hard.
I did. So I brought myself back. I have that cheerleader attitude, but I definitely did not want to be in a cheerleader uniform, you know, having my legs exposed. So what I did is I chose sports that I could cover up, like say field hockey, where I would have the shin guards, you know, and it's a fall sport, so I could stay layered up. You know, running track, you could wear thermals, and that was totally acceptable, and no questions were asked. But I never wanted to wear shorts. I never wanted to be, you know, where my skin, where I felt like I had to kind of defend what was going on with what my appearance was on my body and my skin. And it did take some trial and error and what made me, you know, feel okay.
Doctor, Sarah talked about topical treatments that can help treat plaques. Are there other treatments available to patients?
Absolutely. I love talking about treatments because there's so many options for patients now. So we talked about the creams that you can put on the plaques on the outside, but there are also pills that you can take by mouth and also injectables called biologics. What we're here to talk about today is one treatment called Otezla. It's a pill that treats moderate to severe plaque psoriasis in patients who are candidates for systemic therapy or phototherapy, and they can get 75% clearer skin at 4 months.
In fact, Otezla, apremilast, is a prescription medicine approved for the treatment of adult patients with moderate to severe plaque psoriasis, for whom phototherapy or systemic therapy is appropriate. You must not take Otezla if you are allergic to apremilast or to any of the ingredients in Otezla. Otezla is different. It's not an injection or cream. It's a pill that treats differently. Otezla is a pill that works inside the body. Let's show our viewers some before and after pictures and see the improvement after taking Otezla. And I just want to note that individual results may vary here. Doctor, tell me what we're looking at now.
Yeah, so you can see here, before Otezla, the classic red, markedly elevated plaques with that thick silvery scale. And then 4 months later, patients can get 75% clear. Every time my patient comes back and I get to see them for follow-up, I'm just as excited as the patient is.
Sarah, you're taking Otezla. How are you doing?
I've noticed an improvement in my skin, less plaques, less flare-ups, especially around the elbows and legs, where those were my most problematic areas.
Doctor, are there any side effects?
Side effects are important. I tell all my patients that some of them can get some diarrhea or headache.
And we should add, don't use if you're allergic to Otezla. It may cause severe diarrhea, nausea, or vomiting. Otezla is associated with an increased risk of depression. Tell your doctor if you have a history of depression or suicidal thoughts, or if these feelings develop. Some people taking Otezla reported weight loss. Your doctor should monitor your weight and may stop treatment. Upper respiratory tract infection and headache may occur. Tell your doctor about your medicines and if you're pregnant or planning to be. Please visit Otezla.com for full prescribing information. And how is Otezla taken?
It's a pill, so it's really easy. You take it by mouth. It's taken twice daily after a 5-day titration period and can be taken with or without food.
Sarah, I want to end with you. Any advice for someone who may share your story and feels the way you do?
Don't give up hope. It's a journey, it's not a destination. Work with your doctor, keep your appointments, and make sure that you understand your plan can change and find what works best for you.
Great information. Doctor, thank you so much for coming in.
Thank you so much for having us.
And Sarah, good luck. You look great. Thank you so much. And if you'd like more information on Otezla, you can visit Otezla.com. Call the number on your screen, see their ad in Shape magazine, or talk to your doctor as well. You can also go to our website, thebalancingact.com. We'll be right back. Thank you.